YouTube channel for another live session. This session is brought to you as a patient awareness initiative on Be Aware of Leukemia during COVID times in association with Sanofi India. In this session, we have the privilege to host Dr. Padmaja Lokireddy, a renowned hemato-oncologist with special interest in bone marrow transplant with many credentials in her field of expertise. She has been working as a consultant hematolo-oncology and bone marrow transplant at Apollo Hospital, Hyderabad. She has received many awards and recognitions, including Meritorious Award in the field of hematology and transplant by International Biographical Centre, Cambridge. Her name was also included in the International Biographic Dictionary, Cambridge, and recognized in the top 100 physicians for 2016. Before returning to India in 2015, she spent time at Johns Hopkins Cancer Hospital, USA, worked as bone marrow transplant consultant at Queen Elizabeth University Hospital, Glasgow, University Hospital, Birmingham, UK, Ipswich Hospital, which is part of Cambridge, and University Hospital, Leicester in the UK. Welcome, Dr. Padmaja, and thank you for taking out time for the session.
Thank you.
To our viewers, as we all know, the world is going through an anxious time of pandemic. Things have changed in reference to our normal routine. This seems to be a more difficult period for the people who are already diagnosed with pre-existing conditions. Among these, patients suffering from leukemia are facing multiple issues with the looming fear of the contracting disease. Thus, to combat this fear and to answer critical questions, we need knowledge from medical experts like Dr. Padmaja Lokireddy. During the next few minutes, Dr. Padmaja will be talking about how this deadly disease can impact our kidneys and what measures we can take to protect ourselves. My request to our viewers who have tuned in, please feel free to ask your questions in the comment section and we will take them later. Over to you, Doctor.
Hello, very good evening. Thank you for giving me this opportunity, Librate and Sanofi. It is a great time to talk about. This is a perfect time to tell what is the things what we need to do on the surface during these difficult times. Initially, we're going to move the talk with few slides just to explain the outline of it, and then we'll open the discussions for question and answers. So I'll try and share the screen. So leukemia awareness during COVID is our current topic. Leukemia meaning to say is blood cancer. If you look at how common it is 1 to 2 per lakh every year. So we expect about 900 new leukemia patients in our dual Telugu speaking states. If we look at 9 crore population, you should have about 900 leukemia patients. Why is it important to know the numbers? Because it's not so uncommon if we look at it. And these blood cancers are life-threatening if they were not diagnosed on the right time. Early diagnosis is the key, and we do not want to miss it. There are different types of leukemias. We've got acute leukemias and chronic leukemias. All that's what we're talking about, the deadly disease, the cancer which has got the highest mortality. The deadly cancer is one of the cancers called blood cancer, that is acute leukemia. There are acute myeloid and acute lymphoid leukemias, and chronic leukemias, meaning to say they're indolent, they're slow growing. That is like chronic myeloid and chronic lymphoid leukemias. And most of these chronic leukemias treatment is given as an outpatient. If you look at how the leukemia presents, many people would ask this question, how do I know I have a leukemia? Nobody will have acute leukemia for more than 4 weeks before they got to have a diagnosis because they're very fast growing and they can happen in people who are otherwise well prior to this. People present with fever, fatigue. They could be unwell and having a breathing difficulty. They may find bruises on the hands and legs without any trauma, or they may have a severe anemia and low platelets on the blood test, or on the blood test called CBC, the white cell count may be very high. So whatever the symptoms I've just said, they all look like a COVID symptoms at this current time. So it's very important, if you've had any of these symptoms which is lasting for a bit longer, you should have a blood test done. And if the CBC shows normal parameters, you don't have to worry about any other blood disorders which could present like this. But if you did see very low platelets, very low hemoglobin, or a white cell count more than 30,000, one should click to say, is it something to do with a blood related problem? And you should consult a specialist. So the COVID is mimicking many ways. So it's important to know these. Early diagnosis is very important in leukemias because leukemias, what we're talking about, they're deadly diseases, they have a high mortality. But at the same time, the cost of treatment is very high. And the outcomes, the earlier they come, the outcomes are better. Suppose if a patient comes very early, they come to outpatients with abnormal blood tests, their outcomes are very good. They tend to get treated on the ward. But if they become very unwell, they tend to come through emergency with a very high blood counts. They tend to go on to ICU. They may be ventilated. So the outcome is very, about 50%, the outcomes are reduced. And more or less, the cost of the treatment is doubled by the time they come out of the hospital. So it's important to have a very early diagnosis, not just because of the cost, because of the outcome. And leukemia treatment, it goes in very much of a phases. The first treatment phase, which lasts for about a month, is called induction. There are now a lot of consensus guidelines in American society. How do we treat younger patients? We have done a study in UK NHS, National Health Service, have done a study among 38 patients who have contracted COVID during their leukemia treatment. Their outcomes are no different to the non-COVID patients in a younger group. But in an older group with the comorbidities, of course, the outcomes were much different. So by this, they've said that they've given a clear-cut guidelines that patients with a COVID who are younger should continue to have treatment appropriately along with a standard induction protocol. Only in elderly patients, we would adopt low-risk strategies where you would avoid a longer stay in the hospital with some kind of subcut injections and newer tablets. And what is important in leukemia treatment, why do we have to talk about it today, is one, they have a long length of stay, about a month hospital stay is there for the first induction treatment. We can reduce the length of stay and we can give a less intensive treatments in an older group. Now, we always have to test for COVID prior to the admission and if there were any symptoms prior, during the course of the treatment. And there are a lot of other medications which interact with the COVID treatment, so one has to be aware of that. Whenever we have a patient with a COVID positivity, we tend to defer the chemotherapy for about 2 weeks until it is negative, unless absolutely it is necessary to continue the treatment. And of course, we would want to get the recovery of the blood counts with growth hormones. And also, when the COVID treatment is going on, you all know that we give a high dose steroids, so which puts you at risk of fungal infections. And of course, there is a shortage of blood products one has to be aware of during this time. All patients should be treated in single rooms. So leukemia treatment is given in a dedicated leukemia centers. So we should have separate rooms for these patients, and the staff should be delineated separately for leukemia patients, and they should not be posted in any of the COVID areas. Robust screening practices are important, and we need to limit the number of visitors into the hospital and a strict health screening prior to they enter the leukemia area. And of course, the patients have to keep themselves safe with all these three measures, which we keep talking about: a social distancing, and we would recommend N95 masks. At every situation, they have to risk assess to see what is my risk of getting the COVID from others, and they have to maintain that distance, hand hygiene, and wearing a mask all throughout the time. And hand washing is the key and the most important thing. And we want to limit the number of visits they come into hospital, so they could adopt into online consultations prior to coming in, so they can discuss with the doctor whether there is a necessity to come in. And of course, now we have a home care bloods, and the medications can be ordered from remote. So all these can be planned well. So the time is used judiciously, and their visits are planned, and there would be less amount of a waiting time during the outpatients. And relatives caring for leukemia should follow the same advice as they tend to stay together as the leukemia patients are more unwell. The relative or the caregiver are staying with them for more than 4 hours in a day. So if they contract COVID, there's a high chance they would pass it on to the patient. So they take all the precautions exactly how the patient takes. I want to give few tips on the face mask. We've got various face masks, like N95 mask is the top one, and a surgical mask and a cloth mask. I've given you some photographs. You can see that how the mask should cover. It should cover the upper part of the nose and the mouth, including the lower end of the chin. So that way you have sealed the area, the air does not enter. And N95 mask has got a press clip on top of the nose. You need to press that so that the air does not leak through it. N95 masks are set so because they filter about 95% of the particles in the air, which are less than zero point 0.3 microns. So it is important not just for the COVID, it is important to prevent any fungal infections. And actually, in the study, leukemia patients did not have a higher incidence because they were already taking all these precautions in terms of prevention of their neutropenia. And coming to the bone marrow transplant, transplant is one of the key things in leukemia patients. Patients who are having autologous transplant are deferred until the COVID peak reduces. Every time we have to look at a risk benefit for the transplant. And anytime we collect the donor cells, we always cryopreserve to avoid any problems while the collections and the transportation. Patients who have completed 3 to 6 months, completed treatment, after about 6 months, their risk equalizes to general population. Especially in allogenic transplants, we say they take about a year for their immune system to get back to normal. So it's very important to diagnose leukemia early and conquer the disease. With this note, I would like to open our talk for the question and answer session.
Thank you so much, Doctor. That was indeed helpful. We will now take few questions from our viewers. So, Dr. Padmaja, what are the new challenges as leukemia patient during current times in terms of diagnosis and treatment?
So, if I give you a general context, what's happening, previously we used to get about 80% of leukemia patients come through the outpatients. They come with a history, they've got a fever, not feeling well. They went to their general practitioner, they've got their blood test done, they found to have some abnormalities in the bloods, and the doctor said to go and see a specialist. Or they found something called a blast in the peripheral smear. This is the usual scenario prior to the COVID. Maybe about one or two patients come through emergency being completely unwell. But the current times, only about 10 to 15% of patients come in this way to outpatients. About 80% of patients are coming to emergency with a breathing difficulty, fever, not being well. The first concern comes is a COVID. So they're tested for COVID, they're isolated, then they got the blood test done and blood smears. They found that there is a leukemia cells, and they have to be cleared from that end to say they do not have a COVID before they moved on to a leukemia premises. So by then, the time is being wasted because the turnaround times for COVID is not exactly the same everywhere. And most of these patients tend to have a lung infiltrates because they have a very high blood counts. The lung shows some abnormalities on HRCT. So again, infectious diseases will say that you cannot completely say that it's not COVID. So you end up wasting close to about 3 to 4 days in intensive care before starting leukemia treatment. So the 4 days in leukemia treatment are the key days. It's very vital to start the treatment early. So the outcomes are not as good as before. So that is the biggest difference. Patients are coming too late to hospitals now. And that's a challenge for us.
So, another question we have from our viewers, Doctor, that if a person needs to get treatment with blood products like red blood cells, stem cell rescue, and platelets, should that person be concerned about possible contamination?
So no, I would say these COVID virus is not a bloodborne virus. It is a respiratory virus. So unlike HIV, hepatitis B, hepatitis C, which are spread through bloodborne diseases. So yes, we screen for them whenever we collect blood. Blood donors are collected for all these samples. But COVID, we do not have to worry about a COVID contamination in the blood because they do not spread through that way. And of course, there's a lot of a screening when we collect donors for blood donations. We always ask whether they had any respiratory symptoms, they've been unwell in the recent times. So a lot of screening happens. When coming to the stem cells, the donors are tested for COVID prior to collection and also on the third day of mobilization. So there is a strict screening for stem cell donors, but the rest of the blood products as a standard screening protocol. And I don't think we need to worry about that at this time.
So are cancer patients at a higher risk of developing the coronavirus?
So
So what these cancer patients can do to reduce the effects of coronavirus?
it's a great question. Ever since the COVID came into picture, back in March, we were frightened that what is going to happen to our cancer patients. Because we all know cancer patients have got a very poor immune system, and they must be the ones who are going to get this virus. But surprisingly, in the new studies, they've shown that cancer patients are not at, uh, whether they may be at higher risk, but we are not seeing a higher incidence in cancer patients. Probably they know that they're vulnerable and they are protecting themselves, and they are used to wearing the face mask and all these measures what we are talking about. They've been doing that and they restrict themselves, so the incidence is not that high. And we just spoke about in a blood cancer patients where the treatments cannot be deferred, and the study in NHS UK shown that in a younger patients, the high dose treatments have not shown any inferiority in COVID patients compared to the non-COVID patients. So younger patients, if they have a COVID or not, they should be treated for the disease because it's life-threatening. You always look at which is the most riskier thing, and you have to go on with the treatment. It is quite reassuring to see that information.
That was really helpful, doctor. Thank you. Another question we have from our viewers is that if the person is diagnosed with COVID and simultaneously he also has to go through his cancer treatment, so what are the precautions that person should take?
So we just spoke about acute leukemia, a new diagnosis, but for anybody else, a cancer patient, we always ask one question: can this patient's cancer treatment can be deferred for 2 weeks? Is it going to have a major consequences for that individual? In most of the cancers, 2 weeks deferment is not an issue. So we tend to hold off the treatment and wait for the COVID clearance and then restart the chemotherapy, except in an acute leukemia where you cannot wait. In most of the patients who are ongoing treatments, they can be deferred for 2 weeks. So it is a risk benefit for that individual. In most of the cancers, yes, it should be deferred. Otherwise, the acute leukemias in the early phase.
So will anything change with this, like with the cancer-related medical visits these cancer patients are doing at the hospital? So should
Right.
they should cancel their treatment or follow-ups, like keeping in mind the current situation?
They should not cancel their follow-ups. They should be in connection with, even if they had a COVID positivity, they should always inform their cancer specialist, and there should be a dual consultation. So the cancer specialist should know that you had a COVID, and they always look things in the context. And they may say that this patient is at higher risk of viral infections. Let's reduce the steroid dose in the COVID patient. So we make that kind of adjustments, and there are certain chemotherapy medications along with remdesivir, they can cause cardiac side effects. So we tend to look at, is there any drug interaction? Do we have to dose reduce anything? But never just stop the follow-ups. You can use an online platform now. You can, so like Apollo does, Apollo 24/7, and a lot of other online platforms have come up. And you can meet your own doctor who knows about you. It's always good as online consult to see the person whom you have already met because they know about you. And it's always good to have a physical consult. But if you've seen them once, and you can follow up, and if they feel that it's necessary that you should go, at least the number of visits you go into hospital are much less. That thereby you would reduce the risk. And as an individual, one should look which is a peak time. You want to have a spacement between the patient to patient. So you can identify what is the time where there are less number of patients, how you can reduce your risk and move forward.
So another important question we are getting from viewers, doctor, that are there any special precautions that people with cancer should take in this current situation?
Absolutely, a great question. So, from a personal perspective for a cancer patient, it's a very key question they want to know. Of course, the three things, the key things are the social distancing, wearing the face mask all throughout, and a hand hygiene. These are the three most important things, and it has to be a part and parcel of your life for the next couple of months until we are very clear. But at the same time, you should not be obsessed and then stay back, but you have to use your judgments for that. And other things, continue your follow ups. If you were on a very high dose treatments, there are certain set of guidelines for each disease, how we have to monitor them. Now, it is an international consensus guidelines. Suppose in a leukemia patient, and it depends on how bad the COVID is in your area. Suppose Hyderabad now things are starting to, if you compare one state to the other state, the states which have got a very high incidence, at period when it is a peak time, you want to hold off the treatments because you don't want patients to come into hospital and catch a COVID. So you want to minimize that particular risk. And the hospitals should have the robust policies to designate COVID patients and non-COVID patients, the entrance, exits, everything should have staff looking after, everything should be separated. And the other thing is they should have a very strict screening policy. Before you admit a patient, you should have a testing cleared off. There's no suspicion, all those kind of things. And from a patient perspective, reducing the number of visits when they're coming to hospital, they have to assess how much crowd is there, whether you need to space out, so stay away from the rest of the group, and taking all these precautions and on using the online platform and making sure you continue your medications. But you have to speak to your doctor before you stop any of your medications. There are patients who stop treatment and have relapsed the disease, and it's very difficult when you have to have a retreatment when they relapse. So it's best to continue with the treatment in a risk assessed way. Oh,
So
you.
suppose, doctor, the leukemia patient is tested positive for coronavirus. So how long do the patient has to remain in isolation?
So now the current consensus is for 2 weeks. Previously, we were saying 2 weeks, and then they have to be tested for PCR negativity before they come back into the hospitals. But now the current guidelines are 2 weeks, and if they do not have any symptoms, we do not test for PCR. The the basis for that is they're saying the dead virus continue to stay in, but it does not affect others. So you may get a PCR positivity even after 2 weeks. So we tend to not repeat the PCR. 2 week screening. If they do not have symptoms, end of that, they come back to the screen.
Okay. So another question from our viewer, keeping in mind the current situation as the doctors have limited working hours, and it's a bit difficult to contact the doctor at this time. So how do they manage with the disruptions in their treatment? What care should they take?
So yes, it's difficult, but it's probably not impossible. So I would say you still have to keep up with. You may not be able to physically see them continuously if you're traveling for a longer distance, coming to the city to see a specialist. That may not be possible. But online platforms are available even if you are in a very peripheral area. So I think it's important to continue to have that connection. And if you cannot do that, at least you should be phoning their secretaries and leaving a message for them, and they can get back to you at their leisure time. They may not be able to take your calls 24/7, but leave a message and ask them to call back. People tend to, and leave your questions. Sometimes they come for an online consultation platform. They're not used to it, they're not prepared. So they just ask one question and the consultation is done. And they had several questions in mind which they forgot to ask. So it's important they make a list of questions, because when they speak to the doctor, things may not come in a flow because they're not used to that. So it's important to write down all your questions and pass it on, or write down all your questions and take a picture of that and upload that. So the doctor can process your questions before they come to you. So that's a way using your time very judiciously.
Also, doctor, can these patients go for their scheduled infusions regularly to the hospitals, keeping in mind the current situation?
So again, if it is during the peak time of the COVID, in certain areas we have to differ. And if it is something where the symptoms are coming down, yes, you have to discuss with your doctor. Can your treatment be changed into a tablets? Is there any alternative for your treatment? And how bad is, what is the risk of stopping this treatment for a temporary period? Say, for example, it could be 4 weeks or 6 weeks. But the big problem for us now is we don't know when the COVID is going to end. So what we want to know is you want to avoid the very high risk time periods, and you may have to accept a little bit risk and then go through the things in a judgmental way. Because we are saying that COVID may be with us for another year. We can't stop treatments for a complete year. So when there is a peak of the COVID cases, you can defer and delay. And then there is a time point you have to start thinking about it. So each individual have to ask one question: is there any alternative for an injection to a tablet? Or is there any way I can just hold it temporarily and monitor my disease and then get back onto the routine afterwards? And look at, is there any local alternative? If you're traveling to the city, you have to ask your doctor, is there anybody locally whom they can liaise with and then get your treatment locally done, at least by your physicians. Some of the injections what we give for bone protection from in cancer treatment, they can be given by physicians. So finding out what are the best ways.
Okay. So, doctor, can you discuss risks and benefits of wearing masks, gloves, and respirators? As we know that in current situation, all of us are advised to wear masks, gloves, and respirators. So, what are the risks involved with it, and what are the benefits of wearing it?
So it all depends on who is wearing it. For a healthcare professional, we have to wear it because we are in a high risk area. We are exposed to the people, so we are in a high risk area. We have to wear it. The moment you enter the hospital, you've got everything, and you have to. One has to minimize. I'm telling from a doctor perspective because we're in a high risk area. How we judge at each situation, then you can imagine how you have to judge. So you enter the hospital, you're wearing everything. You've got patients coming in, they could be positive. So you keep the distance. In outpatients, we keep the door open. So you don't want it to be in a closed environment. About the chairs are a bit further, and you're not face to face exactly a right angle. So you're keeping your face a bit further away. So your direction of airflow is a little bit different. Thereby, you're reducing. And the contact, the files, fomites we're talking about, they're slightly at a lower risk. And whenever the situation is over, you've gone outdoor and there is nobody around, you can remove your mask. You don't have to wear your mask while you're driving because that's your own environment. Unless you've got a driver whom you don't know, then of course you have to put your mask. But if you're self driving, there's nobody in the car, you don't have to drive with a mask on. You can just remove the mask and drive on. And if you're in an open environment and there is no one around, you don't have to wear your mask. So it is about a close proximity with the number of people and the amount of time you spend. Suppose you visited a shop to pick something, don't spend time choosing the best one. You got to be quick in and out. So your point is you should not get a virus. You're wearing the protection and everything, but every situation they have to minimize. So if you've gone on a shop, there are six people in a crowd, you stay away from, let them discuss before you step in. So you have to maintain your distance, whether others do it or not. You have to see that what is my protective areas. And wearing a mask, of course, a lot of people are wearing very small masks. People come to outpatients. A big man, a 6 foot man wearing a small, tiny mask, a standard mask will look like a baby mask. It's not even covering half of the chin. So the mask should come underneath the chin until this area. So you're covered. And it should be on top of the nose, just below the eyes. It's not on the tip of the nose, it's just beneath the eyes. So it's important to have the coverage quite nicely and firmly fix it. N95 mask we recommend because it reduces not just the COVID risk in cancer patients, it reduces the fungal infection risk, which is also another dreadful thing. If at all, if you contract COVID-19, we give a high dose steroids, and high dose steroids meaning you fall in for a fungal infection. So in a diabetic patients, in a cancer patients, in a COVID patients, when we give steroids, we are seeing an increased risk of fungal infections. And sometimes the COVID patients are dying not because of COVID, they're dying because of fungus. So it's important to take precautions to prevent infection. Yeah.
So another
And you
question we
asked
have.
about the valve mask, isn't it? Valve mask, when you wear a valve mask, the flow when you breathe out, it's coming into the environment. So it's not safe for others. It may be convenient for you, but it's not safe for others. So we advocate people not to wear it.
Thank you, doctor, for enlightening this fact because people nowadays they think that wearing valve mask is safer, more safer than wearing the normal mask. So moving on to another question, we have what are the treatments currently available for COVID-19, and what is the vaccine currently available to treat the disease?
So what treatment? There are a number of treatments. What we talk about. Some are asymptomatic; they don't need any treatment. You just have to monitor them, and you've actually found out they had a COVID-19 because you screened them for some other reason. Now we get a lot of negative results because we are screening. I'm screening, suppose in a day, in a week, probably as a cancer specialist, I put a request for about 20 COVID tests. But purely, I know probably my chances of a patient's coming back positive are close to about 5%. But I'm requesting more because I want them to be negative before we do a procedure, before we admit them. So there is a lot of screening happening. That's why you're seeing a bigger number of negativities. And you asked me a question about,
The
just say it
vaccine which
again.
is currently available.
So the vaccine, it is going to take time. So coming back for the monitoring purpose is one. And the second thing, when they get the steroids are very important because in COVID, it's not the virus which is causing a problem. The inflammation caused by virus is a problem. When you have an inflammation, you have a high cytokine, certain kind of chemicals which gets released into the bloodstream. They damage the organs, lungs especially. So we give steroids to suppress the immune system. So there is no inflammation. That is the basis of giving steroids. And antiviral remdesivir is given whenever the oxygens are going down. And the next stage is a plasma therapy. Whenever people come into hospital, they stay, we give steroids, the sugars go up, their diabetes is not under control, then you have to go on insulin. So there are little other things will start off when they're in the hospital. So it may not be just the COVID. There are other medical problems will get under not under control, and you have to get on top of them. They may get a bacterial infection, may go on a ventilator, and the new set of problems will come. And the blood clot problems are another thing in COVID-19. So we always keep them on a blood thinners. So we give them steroids, we give them remdesivir, we give them blood thinners like heparin, Clexane, or so on. And the plasma therapy is the last one. We don't tend to give it for everybody, but people who cross these beyond where we think they could benefit, they will. Vaccine, there is still a long way. Probably it is going to take a year to come through. So,
Okay. So, doctor, we hear this fact that vitamin C offers protection against COVID-19. So, would you like to enlighten this fact that, like, really it helps, and especially the leukemia people suffering from this leukemia disease, is it helpful for them to consume vitamin C?
so vitamins are good for, but we don't know. There is no evidence to say we've never done a study. In 100 COVID patients, 50% we give vitamins, 50% we don't. We've never done that. But we know that vitamin C has got a property of anti-inflammation, antioxidant. So that is the background we use it. And it's very cheap. There is no major side effects. So why not use it is our logic, and no study will be done because there is no major gain of it's not expensive, there's no side effects, so why not give it? That's a kind of a logic we all give it, but there's no hard evidence. that it could prevent COVID. But when they have a COVID, yes, you can. If it answers your question. If you want to take it, you can, but we don't advocate that to take. Somebody were asking me to prescribe uh, micronutrients, vitamins, vitamin D, vitamin C, zinc, and so many other things. One of my patients is asking me to prescribe. Is there evidence to produce that to prevent a COVID? No. But if you want to take it, by all means, but don't do in excess. That's it.
So another question we have from our viewer that because of current situation, current COVID situation, people are under a lot of stress, and also because of the current situation. So, what suggestions will you give to our viewers to how to deal with the stress because of current situation?
So stress can be in different ways. So if you're talking about a cancer patient, the stress could be whether you're going to contract a COVID by traveling around. That's one of the stress you have. And the second is what is going to happen to my treatment? What is going to happen to my disease? And the third thing is there is a lot of other things like finances, social situations, who is going to care for them, all these. So we have to think about each one for a particular person and then make a choice what we have that as an individual. Suppose if you're a cancer patient, you have to make sure that I've taken all the precautions. This is in my arena. I have done that bit. So I've done everything to minimize my risk. That's what is in your hand, and you have done that. And you have to keep yourself, you have to have that attitude. You've done your bit, and you're going to make sure, that is the best you can do, and you've reduced your risk. And social situations, have your friends, chatting, reading, having the hobbies, all these will help relaxation. So there are different ways you can do. But the treatment wise, you have to always follow your doctor's advice. If you have change in situations, discuss with them. Change in financial circumstances, discuss with them. There may be an alternative which is cheaper, maybe a little difference in the outcome. So you could still go for an alternative treatment. So always discuss your options very openly. That will give you a good way of living.
So, doctor, moving on to our last question for the session, that what else the cancer patients need to know about coronavirus?
So one thing I want to say, we were very much scared in back in March time, what is going to happen for our cancer patients. We are not seeing increase in death rates because of corona in cancer patients. So you don't have to worry so much, but you do have to take precautions because having COVID with the cancer is not an easy thing to tackle, especially older patients with the other problems. So stay safe at home and continue your follow ups. You don't have to worry that it is going to catch you. Actual incidence of COVID in cancer patients is very, very low. Even in the studies, in a whole of UK, they only found 38 patients among the 900 they treat every year. So even if you take a 6 months, the incidence is very, very low. So be safe. Don't think that you're going to get it. Be brave and just have to face it. But what we have to do from our bit is we do everything to minimize our risk. We follow up our appointments and see what is best for an individual and discuss with you.
Thank you so much, Dr. Padmaja, for your time this evening. We hope our viewers could get help from your informative views. This was a very enlightening session, to say the least. To our viewers, please reach out to your nearest specialist doctors to get your personalized consultation on your health. Librate is also here to convey true and authentic information during this COVID era. This marks the end of the current session, and we will be back with more information in the next. Until then, stay tuned.